Hello, I'm Robinah Kaitiritimba. I work for Uganda National Health Consumers Organization. We were supported by the WHO Country Connector to look at the Ugandan case of how the private sector is engaged to be able to deliver the strategy of addressing COVID-19 as a pandemic. The things that Uganda has done over the years is a policy of public-private partnership that defines the relationship between the public and private sector. So when COVID-19 hit in 2021, one of the first things that government did to align structures was to employ the public-private partnership policy. The Uganda Healthcare Federation, which is a coalition that brings together the private sector players and the majority, many of them, especially the ones in Kampala, in the city, are part of Uganda Healthcare Federation. So UHF was the major player at the national level, receiving information, coordinating information, and making sure that the private sector is informed and engaged and is providing services. The government, through the Prime Minister's office, established a communication channel that included the private sector that would delay all information. Mistrust remained in some instances, and the private sector complained that they didn't receive the equipment that was meant. For instance, the protection equipment was given only to government and not the private sector. So these aspects also increased to undermine the trust. Government did set up a coordinating mechanism. This arrangement under the Prime Minister's office established a task force that was mandated to bring partners together, especially the private sector, and it went beyond the health sector, private sector, to include the business community for mobilizing resources and coordinating information. Government worked together with the Uganda Healthcare Federation to train both the public and private sector together. The Uganda Healthcare Federation was one of the leaders in training both the public and private sector in responding to vaccine deployment. And the training for COVID-19, the government was able to give access to medicines to both in the private and public sector. If you look at the way government targeted what they wanted to do, like vaccinating vulnerable groups and then schools and people above 50 and then the rest of the public, we believe from the findings that progress was made, that Uganda did achieve on what it had set to deliver. We know that progress has been made, but government needs to open up more to the private sector and build more trust, because the private sector reaches about half of the population, and it is the first point of contact for the population in many instances. We need to have the private sector to give them the resources they need so that they are not encroaching on their own private resources. The government needed to work through the private sector and the public to be able to deliver messages that build confidence and encourage people to go for vaccination. That is still a challenge. We see a lot of resistance, and there is a lot that the private sector can do. Government needs to listen to the challenges that the private sector has and be open about reaching solutions in these challenges.